Hello everyone, welcome to today's video. I'm starting a new series regarding NEET PG counseling, in which I'll be discussing each specialty which is available for grabs in this NEET PG 2024 counseling. And we'll be starting with the first specialty, that is ENT. So I have the pleasure of having Dr. Anupam Kanodia, who is also my senior from AIMS. He is an ENT surgeon and a practicing ENT surgeon in Jaipur. So Anupam, welcome to the video. Welcome to the channel. Tell me about yourself.
Hi Rishabh, thank you for inviting me. Really glad to be a part of your show. And it's really a nice initiative from you. I wish such similar initiatives were there back then when we chose a specialty. And it's really a good thing that you are doing, guiding your juniors. So, congratulations.
Thank you, Anupam. We'll start directly with the main question. I think that bug us. Anupam, for all your reference, did his undergraduation from AIMS, his post graduation from in ENT from AIMS itself, and then his senior residency from AIMS as well. Anupam, tell me about ENT as a branch. I think all of us know because we have studied it in MBBS, unlike radiology. So ENT का सब लोग को idea होता ही है कि भाई क्या है इस branch में.
Yeah.
But as a resident, when you take up that subject in your post graduation, how is it different? What ENT actually entails? क्या क्या cover होता है इसमें broadly?
So, Rishabh, thank you for that introduction. Rishabh, ENT as a branch is, I think, one of the most diverse branches that we have. And sadly, it doesn't get its due share during MBBS. You also know that. So,
Yeah.
we hardly spend any time reading ENT in our MBBS exams. And that's a sad part. The thing is, it offers you a diverse arena wherein you can choose in between being a medical specialist or you can choose to be a surgical specialist. So there are people in ENT who don't perform surgeries routinely and are purely into medical practice, like allergies, like vertigo. And then there are people who do purely surgical work, like a lot of skull base, head and neck oncology, facial plastics. I have now started doing sleep surgeries. So
Hmm.
it's a very new domain. So there's a plethora of options available for somebody who goes into ENT.
Hmm.
And I think एज अ एमबीबीएस हम लोग को इतना प्रॉपर एक्सपोजर इसमें मिलता नहीं है एंड आई रियली विश प्रॉपर एक्सपोजर मिलना स्टार्ट हो बिकॉज पीपल रियली नीड टू चेंज देयर आउटलुक टुवर्ड्स ईएनटी एज एमबीबीएस स्टूडेंट्स and I really wish that people start taking ENT at top of the ladder itself.
Right.
Let's
And
hope that change comes soon.
yeah, and I was looking at the NEET SS counseling brochure as well. So ENT is a feeder branch. Is ENTs, MDs are or MS are eligible for MCH in neurosurgery, head and neck surgery, plastic surgery, surgical oncology.
Yeah.
So I think that is again a very diverse branch to have, even if let's say you are not getting surgery and you want to do a super specialization in the head and neck region. Again, I think
Yeah.
ENT is a very, very good specialty to have.
So like all surgical branches, Rishabh, I think ये branch भी deserves about 6 years of residency,
Okay.
and just 3 years of junior residency is often not enough.
ठीक है.
And especially in tier one cities, people do look for extra specialization, and that is why the question on whether it has a MCH or not. I
हम्म.
think in peripheral medical college, लोग पूछते भी नहीं है. People don't even ask कि whether there's a MCH after this. It's only a tier one problem.
हम्म.
And MCH is there in four specialties, like Rishabh said, plastic surgery, neurosurgery, then surgical oncology, and ENT has its own head and neck oncology now. So uh, these are the options. If you want to really get into MCH, you have so many options available now. But if you don't want to do MCH, then also there's a route that you can take wherein you can do multiple fellowships or you can train under people who are masters of a particular subspecialty of ENT. So that route can be taken if you want to subspecialize, but many of the ENT pass outs still will see ENT as an end branch and will not subspecialize. So that's a advantage ENT has कि MS करके भी अगर आपको अपना काम करना है तो you can continue doing your work. It's
Majority for practically it is an end branch.
practically it's an end branch until and unless you want to further study and hone your skills.
Hmm.
It's an end branch.
Right. So, since ENT involves a lot of surgery and the surgeries hoti hain, they are microscopic surgeries, fine surgeries. So, as you said earlier, the 3 years is not really enough to master these. So, जो इंडिया में programs हैं, especially based through NEET PG counseling के through state medical colleges हैं, how good is the surgical exposure during MD there, as well as SRship, if at all?
So, अगर आपका लक अच्छा है तो you will land up in a place which has good hands-on as well as learning protocols. MS के टाइम पे बहुत important है that you learn the protocols, you get initiated into the art of surgery. And as a MS, I would not target to master most of the surgeries. Yeah, basic surgeries like adenotonsillectomy, tympanoplasty, septoplasty, that is something that you need to master, and you need to do a lot of hands-on for this. So, but complex surgeries, even like mastectomy, functional endoscopic sinus surgery, something like a thyroid, I would not expect a MS person to be really doing it day in and day out. Yeah, once in a while is fine, but so hands-on का question थोड़ा सा it depends on which place are you doing it from. State medical colleges का थोड़ा सा problem है in periphery. They will not give you that quality of work. So ENT as a branch requires a lot of technical stuff, a lot of technologies in place. So if you're doing it from a good place, you will end up learning a lot. You will end up doing a lot of hands-on. But ultimately, like all other branches, it depends on where you are doing it from.
Right. And so you would recommend doing at least an SRship, 2 to 3 years of SRship post MS to
Depends on what your end target is. If you are a private practice person, then you can directly join a senior ENT person who is into private practice and get associated as a junior consultant or an associate consultant with him
Mm.
or her. Or if you are if you want to get through the fellowship route, you can do a fellowship, you can subspecialize and then set up your own practice or join a corporate. But if you want to still remain broad-minded, or if you want to look at the government route and end up going for a teaching post or a government job, then SRship is mandatory.
Mm.
And
ठीक है.
yeah, SRship also takes care of your hands-on thing. So SRship में भी काफी कुछ करने को मिल जाता है. And उसके बाद if you end up deciding on a subspecialty that you're interested in, then you can go for that fellowship. The fellowships are hardly 3 months to 6 months.
किस किस में
So,
अवेलेबल है फेलोशिप्स?
there are more than 10 subspecialties of ENT,
Hmm.
and like otology and cochlear implants. Then there is laryngology and phoniatrics, voice therapies. Then there is rhinology and anterior skull base. Then there is facial and cosmetic surgeries, lateral skull base surgeries.
Hmm.
Then there is head and neck oncosurgery, as we discussed. Then there is silentoscopy and salivary gland disorders, sleep surgery and snoring problems, like the fellowship that I have done. So there are so many options available. You just need to find your passion. If you don't want to get into a surgical domain, you can do allergy practice. You can do vertigo practice. It also pays you wonderfully.
Hmm. Okay. So, regarding the future job prospects, so like I asked this to all the consultants or those who are practicing. So after any specialty, let's say if I take radiology as well, so you're done with your MD or SRship. There are three routes to go about it. So either you get incorporated into a government teaching program, you join a corporate hospital under previously formed department as a junior consultant, or you third is a private practice that you start on its own. So these three pathways, क्या क्या है इनमें? So for example, government में are there enough jobs for ENT? Corporate में are again departments well established in the corporates, or is it still a private practice based branch?
So, ऋषभ, again, बहुत कुछ डिपेंड करता है वेयर यू आर वर्किंग एंड वेयर योर एंड पॉइंट इज. अगर आपको टीयर 1 सिटी में स्टैब्लिश होना है, तो देयर विल बी सम स्ट्रगल्स अलोंग द वे, बिकॉज द seats are not that much. Government or private, the competition is a bit tough, and like any other branch, there is some saturation. So tier 1 will always have some struggle. Tier 2 and tier 3 cities, you can do a bit as per your own convenience. There are government jobs also, and there are ample opportunities to join somebody in private. So I think tier 1 में there's a bit of a fight, but tier 2 and tier 3 are relatively comfortable.
Right. So if we were to look at the salaries post SRship, because this is
Yeah.
eventually a lot of students ask this question, and it's a very important question. So
Yeah.
what are the salaries that we are looking in a corporate? Because most of students after doing their training would end up joining under someone, either a
Yeah.
private or a corporate, right? So what are the salaries that they should be expecting after SRship or fellowship?
So private practice in your initial days will not pay you that much, because again you are under somebody and you are not getting your own patients. It's somebody else's patient. So आपको इतना नहीं मिलेगा. You will start off somewhere between 1 lakh to 1.5 lakhs. And a similar salary structure is there in government also. In a tier 1 city like Delhi, we used to get 1.3 and 1.3 to 1.5 lakhs between that during SRship. And uh, if you are doing it from a tier 2 or tier 3 city, SRship will pay you about 1 lakh. So, and similar salary packages are there for private also. So, but we need to take into account that expenses are also low in tier 2 and tier 3 cities. So I think if you are smart enough, you'll end up saving similar amount whether you are in tier 1 or tier 2 or tier 3.
Right.
So starting में इतना ही मिलेगा, but yes, once you start making your own brand, once you get into private practice and people start recognizing you, people come seeking your opinion, then sky is the limit. I have seen people who earn in crores per month. So sky is really the limit once you get into private practice. But if you want to go into government setting, go into a teaching post, then you will end up earning like 2 to 3 lakhs per month at a senior faculty position. Apart from all the perks, obviously. So government jobs come with a lot of perks like travel and health. So and accommodation.
1 month summer vacation also.
Yeah, and I think that's the most important perk.
Yeah.
And a lot of job security.
Yeah, a lot of job security. Yes. And EHS, yes. Yeah, so
Yeah, so those perks are there in government. Private practice is a high risk, high reward situation. But yeah, at the end of the day, at the end of 10, 15 years, I've seen most of the people who put in their efforts, they end up doing well.
yeah, so it is a very important question because every branch says this 10-15 year period का एक incubation period, and आप एक बार
Yes.
MD खत्म करते हो, SRship खत्म करते हो, आप you're not really expecting a 10-15 year incubation period ahead. Maybe you're expecting a
Yeah.
5 year incubation period ahead, but 10-15 years थोड़ा सा ज्यादा लगता है, and which is actually true in surgical branches. Surgical branches bloom in their 40s.
Yeah.
Surgeons bloom in their 40s. That is what the saying is. So, what I want to ask specifically here is that if someone, let's say, in a tier 3 city or a tier 3, tier 4 city, wants to open his or her practice, private practice in ENT, ठीक है, he wants
Yeah.
to general ENT covering everything, ठीक है, not any subspecialization. So, what is the cost involved? Setup cost क्या है?
So there's a basic ENT OPD unit that you'll end up buying, which has a suction, illumination, and a X-ray view box.
Hmm.
Apart from that, some instrument trays and some instruments like Thoricum speculum, your tongue depressors, your otoscope. These are the basic stuff that you'll end up buying. Now, today's practice really needs you to have an endoscope also in your OPD. And endoscopes of two types, 0 degree and 70-degree endoscopes. One to look in the nose and one to look in your throat. So uh, these are the basic requirements. Apart from that, a patient chair and a surgeon chair. So they come in a bit costly, and initial days you can just do with a steel stool or and a simple chair. So that's okay in the initial days. But eventually you'll have to shift to a surgeon chair and a patient chair.
So we are
So the
talking about,
whole
uh,
3 to 4 lakhs in the initial days.
yeah, and the endoscopes and the proper instruments, those tray, they come
Yeah,
around.
so everything involved will cost you 3 to 4 lakhs in the initial days. You can go step by step, go with establishing your OPD unit first, and then slowly adding to your armory. And as compared to like if you talk about OT cost will go a bit high when you end up buying microscope and endoscope and monitors. So in the initial days, everybody gets attached to a bigger setup, and वहाँ पे ही पेशेंट ले जाके ऑपरेट करने का ट्रेंड रहता है, because it's very difficult to afford that sort of equipment in your initial days. And that is why I think ENT as a branch also gets picked up a bit later, because private practice में जो boom मिलता है, that's in your 40s and 50s, और वो भी अभी recently last 2 decades में आना start हुआ है.
Hmm.
Like people who were ENTs in 1980s, 1990s, they never blossomed that much,
Hmm.
because ENTs, at the end of the day, are technological branch. You need a lot of tech involved. You need endoscopes, good lighting, good microscope, good visualization, good monitors. So all that has come in last 2 decades. So you really can't blame the old people, but yeah, they could not make this a glamorous branch like it should have been. But now, yes, with all the tech involved, it seems like a much glamorous option than it used to be.
Yeah, so regarding the glamorous part, and I know कि मुझे frankly इतना नहीं idea है इसका, because now I have, it's like been 6 years I have done my MBBS, and MBBS में तो ENT का क्या ही पता होता है ना? तो
जी.
what are the type of surgeries that, and high-end surgeries that an ENT surgeon does?
So I think I'll start off with ear. Ear में जो सबसे high end surgeries रहती हैं, that's lateral skull base surgeries and cochlear implants and BAHA, bone anchored hearing aids. So these are really high-end surgeries. Then you can end up collaborating with neurosurgeons for doing tumors like vestibular schwannoma, CP angle tumors, epidermoid cysts, all that. Then anterior skull base and nose में आते हैं, तो there's a lot of again a lot of overlap with neurosurgery, where you can do pituitaries, you can do chordomas, you can do juvenile nasopharyngeal angiofibromas, JNAs, CSF leaks. Uh, then when you collaborate with plastic surgeon, you can end up doing a lot of septorhinoplasties, cosmetic facial work, facelifts, uh, blepharoplasties, your face enhancement, your lip enhancement, all these sort of surgeries. Trauma surgeries are there, wherein you do maxillary facial plating, your mandibular plating. All this is done. and sleep surgeries are there, which involve palatoplasties, tongue-based reductions, iodoepiglottopexy. Then laryngology again has so many complicated surgeries, vocal cord injection, vocal cord stripping. So there's a whole plethora of surgeries, and most of us, 3 or 4 years from our residency, start dropping off some of the surgeries because we know we cannot do everything. And
Yes.
so, and head and neck oncosurgery is a ever evolving branch in India. It's because of our tobacco chewing habits. It's such a prevalent condition in India, and there are so many uh, surgical options, so many reconstructive options. So there's so many, complicated, complex surgeries that ENT can do.
So, you mentioned about cosmetology and aesthetics and
Yeah,
rhinoplasty. So, there is an overlap between derma, plastics, and ENT in this,
yeah, yeah.
right? So,
Yes.
ENT surgeons, ENT surgeons who are practicing cosmetology and aesthetics, love completely. So,
Yeah, yeah. I know people
diverse.
who have left doing ear surgeries, throat surgeries, basic ENT work, and now are fully into cosmetic work.
Right.
So, and if somebody wants contact of such people, I can give them of this podcast also in a separate personal chat. But uh, you can like sky is the limit. You can get into cosmetology, and there are so many courses, so many fellowships available that you can do. There's a proper 2 year program which is recognized by Global Rhinoplasty Association, and they run it in India, they run it abroad. So you get posted here in India, you get posted in abroad also, and at the end of 2 years, you end up giving a proper exam.
Oh, nice.
So yeah, you can get into rhinoplasties and blepharoplasties, fat injection, lip
Hmm.
enhancement, facelifts. All these sort of surgeries can be done by an ENT because we are very well versed with the facial anatomy. So
So that is great. So ENT is a very, very diverse branch. I think it doesn't get its due मतलब मैं नहीं मिलता है उसको उतना ड्यू ना जितना मिलना चाहिए एज अ ब्रांच एंड
that's what I'm saying, because it was not made glamorous in the 20th century. So it will take its time, but because of the tech coming in, and because of better radiologists like you, we are slowly getting to a point where we can almost treat every sort of situation. So, there's so much of collaboration between radiology and ENT, and so many tumors get embolized, so many tumors are at complicated anatomical places and need to be discussed thoroughly with a radiologist. And all this tech has come in last 20 years. So
yeah.
ये जो ENT का aspect है, this will only evolve in the further years, and I'm sure like it will get its due, and people will start recognizing it.
So that is so nice to hear because, and something which is sad currently is that ENT is still not a top pick by students. Like they still
Yeah,
consider it a lower down in their ranking. Maybe,
yeah.
what do you think is the reason for that? Are the institutes in currently in India not high end? So maybe the top surgeries हो रही हैं बहुत कम institutes में हो रही हैं maybe इंडिया में and बाकी सब.
Yes.
Hmm.
Because of the cost and the tech involved, abhi the ENT, the best part of ENT, the best surgeries of ENT are restricted to a handful of institutes.
Hmm.
Plus, the kind of backup ENT requires, like a good neurosurgeon, a good dentist, a good radiologist. So that team also is not very well established in most of the centers. So yeah, थोड़ा सा एक slope रहता है, एक learning curve रहता है, because most of the peripheral colleges they end up teaching basic surgeries only, and वो थोड़ा सा glamour missing है. But I think another factor is a lot of initial cost involved. Like as a medicine or a pediatrician, you don't need any cost. You just
Yeah.
need to have a stethoscope and you can start off your OPD.
Mhm.
But ENT will require some cost in your initial days. Plus OT करना and basic surgeries को master करना, इसमें थोड़ा सा learning curve है. I'll give you an example. When I was a first year resident, we used to have our seniors operate under a microscope, and we as juniors used to like stand and just observe what they are doing, but we could not observe inside the microscope, right?
Yeah.
तो वो जो प्रॉब्लम था वो एक लर्निंग
Mhm.
कर्व को आपके लेंथन कर देता है. बट नाउ इन एम्स एटलीस्ट वी हैव प्रॉपर monitors
Mhm.
wherein whatever the surgeon is doing is seen
Mhm.
on a monitor. So that way I'm sure my juniors are learning those surgeries better than that I did.
Mhm.
But yeah, with the tech coming in, I'm sure it will pick up.
Yeah.
I'm
So,
very optimistic about it.
so what are the good institutes in India? Okay, apart from central institutes, because NEET PG में central institutes cover नहीं होते. So apart from central institutes which are covered in INI-60, what are the other top institutes for ENT in NEET PG through NEET PG?
ऋषभ, आई थिंक जो बाकी गुड गवर्नमेंट कॉलेजेस हैं, लाइक योर KEM मुंबई और ग्रैंट मेडिकल कॉलेज, so many aims have come up in your all over the India. Then there's Chennai में बहुत अच्छे institutes हैं like MURF, like KKR.
Okay.
They offer DNBs, but
Yeah.
their DNB is really good, and they will beat most of the MS candidates at any given day.
Right.
Then Hyderabad and Bangalore have really good programs. Osmania has a good program. Bangalore में St. John's has a really good program. AIMS Bhubaneswar has really picked up.
Hmm.
And coming to a bit of north, then Lucknow में KEM is evergreen place. Delhi has so many good places like UCMS, like AIMS New Delhi, of course, like MAMC, then your PGI Chandigarh, uh, the DNB programs of Gangaram, of private institutes like KEM Pune, like my ENT Hyderabad, they are really good.
Okay.
And so if you search a bit, you research a bit, and if ENT is your passion, you will get a pretty good place, and you will beat most of the peripheral candidates and on any given day with the kind of training these institutes will offer.
So if we look at the 3 year residency program, because लोग PG का पूछना चाहते हैं, लोग PG ज्वाइन कर रहे हैं. So
Hmm.
3 year residency program में for a student, how do you suggest that he should study as well as, मतलब how he should make the full utilization of his or her MD, balancing studies,
Okay.
clinics, OT?
So I think that's a tough question, Rishabh. uh, I think learning should not be restricted to your hospital. You should keep your eyes and ears open, and there's so much of material on YouTube that you can just see. So many surgeons now operate and live telecast it. You can always learn a lot from them. Another thing that I did during my residency days, and I recommend everybody, even my juniors, is to go out and attend conferences. That gives you a lot of perspective, that helps you network with people. Then third, I would suggest you read standard textbooks. Standard textbooks are called standard for a reason, and nobody can beat them. So now, as regards OT, it's not in everybody's hand. It really depends on where you are, what you are doing, where, how your mentors are. So OT हम ज़्यादा कुछ नहीं कह सकते. जितना hands on मिलेगा मिलेगा. Can't really complain there. But हाँ, YouTube पे you can observe a lot of excellent surgeries. So many surgeons now record and put it there. So learning should not be restricted to your own hospital. That is one thing I would suggest. Then OT के लिए जितना भी टाइम OT में मिलता है, come prepared, read up the case, uh, see a surgery on YouTube if possible, then go and scrub in the case, ask questions from your mentor if possible. So I think that is the best utilization of your OT time. एंड बाकी टाइम में आपको जितना भी टाइम मिलता है आप पढ़िए. देर आर सो मेनी आर्टिकल्स, सो मेनी जर्नल्स, so many textbooks out there, but don't restrict yourself to your own hospital and what your seniors say.
Right, right. So I think we've covered almost every part of ENT, starting from subspecialties to future scope, how to set up your own practice, what are the challenges, and residency में क्या करना चाहिए, which are the good programs to take in India as far as ENT is concerned. So I think we are more than half an hour into the interview, and thank you all for listening till now. And thank you, Anupam, for giving us all this information. And I hope it was beneficial to all of you. We'll wrap up this session as of now with regards to ENT. Please mention in the comment section which other specialty you want me to cover next so that we can take it up soon. So that is all from our side. Anupam, any parting words?
I'll just say that don't go by what the market trend is. If you are uh, a person who is into both medical and surgical branch and you like ENT as a branch, then go for it. This branch will just develop in future, and don't listen to anybody else. Your persona is unique, and don't follow the market. We have seen how branches change and over the course of years. Like in my father's time, radiology was not picked up at all by
Yeah,
toppers,
yeah.
and see the trend now.
Hmm.
So it will change, and ENT will definitely be a more glamorous branch in future, like it's in US right now.
Yeah, yeah. So it is in US. It no IMG gets matched in ENT because it is
Yeah.
too competitive.
Yeah, so I think top branches in US are Opthal, ENT, and I think Derma,
And
Orthopedics. Yeah, so these are top branches, and nobody gets it. And
yeah, it's
I'm
only a matter
sure
of time. Yeah, at the same.
that trend will come to India. Sooner or later, that trend will come.
Hmm. Chalo, thank you so much, Anupam. It was really nice talking to you as a senior also after a very long time. And
Same here, man, same here.
so I'll end the session now. All the best for the upcoming NEET counseling. And please mention any queries that you have in the comment section. Me and Anupam both will be very happy to answer them.
Thank you so much. Bye.